Hello, everybody. I'm Brad Parkinson, and this is the Planet Health Project. I'm with my friend and partner in wellness, Mr. Shannon Brad. This is episode 15, and today we're going to talk about autoimmunity. Shannon, how are you today?
Woo, woo. Yeah, I'm really well.
You're well. That's
year,
good to see.
Excitement.
And you had a good break from 2019, and now you're really refreshed for 2020.
Yes, and you too. We were talking earlier at how life is so fantastic, and bring on 2020.
Yeah, great. And perhaps not so great is autoimmunity, is what we're going to discuss today. It's very common in practice for us naturopaths. It's something that it's very hard to treat. It's a very individualized approach. First of all, I think we'll just give a bit of a broad definition, or I'm actually not too broad because we'd be here forever, but just sort of cover a few bases with the definition of autoimmunity. And then we might go into some risk factors, some functional testing, and perhaps treatment options. Really what we're looking at is the immune system attacking itself, or attacking someone's organs and so forth, like what we have in celiac disease. The villi in the intestinal tract get attacked, while the immune system's looking at things that as foreign invaders, or tissue as such as as a foreign invader, and attacking it. There's more and more evidence, it seems like daily, with autoimmunity coming out with what we understand, and in particular the immune system itself. And quite often we had this dysregulation of T helper 1 and T helper 2 cells that was where we based a lot of our treatment plan and everything on. But now we've got the T helper 17 and T regulatory cells coming into play too. And it's a much more complex picture than what we originally were, taught back in our education, our degrees. And look, it seems like with inflammatory processes as well, that there's more and more evidence coming out each year, suggesting different things and different approaches that would be beneficial in treating immunity and immune dysregulation. So perhaps you can give us a bit more of a take on this immune dysregulation, and why the immune system may turn on the individual and attack the tissues.
Yeah, so thanks, Brad. That definition's right, and as we evolve with information and we learn more, it's exciting to see where it's going, and then it sheds a bit of light on naturopathic and herbal treatment, because a lot of the old protocols, traditional protocols we had, there's gaining evidence to support those theories that they are successful, and they are quite a large component of it. So sometimes we can overthink, and we can think about, what is a specific reason, but we can also, it's very important to step back to those basics of core principles of diet and stress and gut health, etc., which we'll get into, I guess, in the next few minutes of the video.
And is it something you commonly deal with in practice, Shannon?
Yeah, like you, I know that you see a ton of patients with autoimmunity the same, and it seems to be getting worse. And whether it's lupus, or whether it's Crohn's, or whether it's Hashimoto's, or the other autoimmune conditions, they do definitely share a lot of the same treatment strategies of the gut, the stress, the diet, etc. And thankfully, there are some really great things we can do to alleviate those. And let's share with people those. Well, let's first talk about the risk factors.
Yes, look, and who are at risk with getting an autoimmune disease, Shannon?
Yeah, so there's obviously a genetic component. So when we go down the route of genetics, we open up a bit of a can of worms, because are we going to go and do genetic testing? And that's an area that's constantly evolving, with finding new SNPs and finding new markers to suggest, aha, it's a genetic component you are destined to have this autoimmune condition, so that's too bad. I don't like that path. I would prefer to say possibly there is a marker that you have a predisposition, but that doesn't mean you can't do a lot to alleviate those symptoms or even put it into remission.
Mm-hmm.
Yeah, so there's the genetics. There's definitely underlying infection. So whether that is in the gut microbiome, sorry, or whether it's sinus or lungs or bacterial, fungal, parasite, and they're exacerbating the inflammation.
Mm-hmm.
And the theory that's pretty widely accepted is the molecular mimicry, and that's this connection between the, as you're probably aware of, the Epstein-Barr, the glandular fever,
Mm-hmm.
and then also the chemicals and the other infections and stress, definitely stress.
Mm.
Have I missed any there, Brad?
No, I think you've covered quite a few things there. I'm sure we could get into some nitty-gritty details when we look at infections, especially. Yeah, I mean, we quite often have correlation in different studies, and when we can dive a bit deeper and get more specific mechanisms, then we tend to make a lot of progress in how we can treat some of these patients. Yeah, you mentioned genetics, and I think it's good to talk about that, because quite often I've had people do genetic testing and kind of had this view of it's a bit doom and gloom. I'm destined to have this disease, and in this case, autoimmunity. I often look at, I don't do much genetic testing myself. I read some genetic testing that comes my way. I know you do a bit more genetic testing with your patients. But in a lot of case taking, we really search out for or other family members that have a history of autoimmunity, and that quite often is very common with autoimmune patients. However, with gene testing, I think it's important that people know that your genes aren't necessarily going to be switched on under certain circumstances, and that you're not always destined just because you have certain genes to have that illness and disease. Of course, if your lifestyle and diet aren't up to scratch, then you might be at a higher risk, specifically if your diet's tailored a certain way, or you're not very conscious of it. So yeah, look, that's what I wanted to talk about. And was it molecular mimicry you were talking about there? That's there's a lot of interesting evidence coming through on that. And my understanding too is that our own tissue or processes can mimic something like a pathogen, and that is that where I'm on the right track with molecular mimicry there, would you say? And that,
yeah. So
or would you like to elaborate a little bit more on that for the viewers?
Sure. So specifically with the glandular fever, they're thinking that virus, because you don't get rid of the viruses ever, they live in your system.
Yep.
Has weakened the immune system, and then tissue damage is being caused, and then the immune system starts attacking the virus, but then it's also attacking the host tissue. There are theories with milk proteins or food particles. There was some research.
So casein and gliadin from your gluten and so forth.
Well, yeah, that's with the celiac, but even with other autoimmunity, with the leaky gut is the common term, but particles are coming right through the gut into the bloodstream, and then the bloodstream is burdened with these foreign particles of bacteria.
Now, before people watch this and freak out when you say leaky gut, you know, the science now supports intestinal permeability, which is a natural process of the gut to open to a certain degree. But when we refer to intestinal permeability or leaky gut, it's doing it too often and too much. and that's problematic in a lot of diseases, especially autoimmune disease. Sorry, I cut in there. You keep going.
That's okay. It's important to do that as well. I try to simplify things because it seems most people know now what leaky gut is, and it's quite a clear visual, isn't it, of a gut and it's leaky. But the tight gap junction in the microvilli of the villi of the wall, the bowel wall, opens up. So the permeability of the particles come through into the blood, and then they start reacting with the immune system. So that's the whole problem. So instantly we're thinking about gut. And so there is some evidence like a year ago, and they were linking Klebsiella bacteria with autoimmune hepatitis. And then now the microbiome test. So we're talking about functional test, and we talked about genetic testing and the genetic markers like rheumatoid factor.
Yep.
And the ANA, and then there's the microbiome test as well. So the latest microbiome tests are looking at specific organisms that could be potentially precursors for autoimmunity.
Yeah, and just going back on, you mentioned rheumatoid factor, and just to tie it in with the leaky guts, when certain proteins come through the intestinal wall that shouldn't, they can provoke an immune response, and then something like rheumatoid arthritis, you're getting these immune complexes form in the joints. So again, tying it all in, and rheumatoid factor is a test for rheumatoid arthritis, but other conditions as well. So and look, you've gone right into the next stage, the functional testing of it all. Perhaps let us in on what you tend to look for in functional testing, and what some of your most common tests that give you a lot of results, and perhaps give a lot of information and value for your dollar too, because quite often functional testing can give us minimal information and can be quite expensive. So what's the best value for your dollar there, Shannon?
I had some technical issues just there.
Yep.
But my go-to is the microbiome test. I'll just wiggle that there. The microbiome test is definitely my go-to.
Yep.
And just being sure the gut health is right.
Now, when you say microbiome test, are you referring to GI map?
GI map.
Do you have another CDSA test that you're using? So I think from memory, you've gone to GI map. They do call it something else, or something microbiome. I can't remember now.
Because they have a few different companies, don't they? And the GI map was from the US. Yes.
Now it's been because we have higher regulatory rules over here we've now got an Australian version of that GI map.
I'm using the Australian one.
Yeah, that's I think that's the only one available now from labs here, which is a little bit more extent. It's got a few added other features to it, and we know that it's been regulated a lot better than a test coming over from the States.
There is also another one. I can't check for it just now, but it's been on the television, and it's more of a mainstream one, and it's very generalized.
Yeah, there's a few of them. They're like Ubiome or
I think that was it. Yeah.
Yeah. I think are very good for the microbiota count. However, what I like about the GI map or the complete microbiome mapping, I think Nutripath call it, is that it has other things like your zonulin, your calprotectin, different things that give you an indication of inflammation in the gut, or perhaps pointing towards something like celiacs or other issues that can be indicated, and you're getting this whole host of information, and it's very reasonably priced too.
Yes. And I'm the same as you, because we're quite technical, and we want the evidence there as well. So it is presented in that way. The other one also, which I can't remember the name of, it was very generalized, and it said to increase your beneficial bacteria, eat more sweet potato. And I felt, that's, it's kind of general knowledge that you should eat more vegetables. And I found it too generalized. But we're a little bit off track. So the functional tests are definitely microbiome test, Australian one if you can. Then we'll also, for the infective level, so we keep going back to the individualized treatment. So if that patient is experiencing high levels of stress, I might do more of a stress arm and do stress hormones. Or if they're having a sinus infection and they've had a sinus infection for several years, then I definitely want to investigate that. And I often use the Marcon's swab. And they may have a fungal infection or an antibiotic resistant bacteria up there. So I guess the patient sitting in front of me, I would try and gather more data about something that is linked about the infection, maybe urinary tract, like a mycoplasma, or upper respiratory tract, maybe sputum sample. Yeah, but the gut is quite the core, and the gut is, for most people, if there's no apparent infection, I would do the gut for sure. Yeah.
Excellent.
And then,
what about inflammatory markers?
Well, sometimes patients have already been through a lot and they've seen a rheumatoid specialist or an endocrinologist or whatever, and they're being monitored with their inflammatory markers like C-reactive protein, or they may even be on methotrexate or similar things, and they're monitoring their liver function, or they're having a regular full blood count because they want to be sure that they're not damaging their immune system. Or so we could look at those markers in there, like the ESR.
Excellent.
I'll make a point about the ANA, which is interesting. I read that it's estimated that around 20% of the population have raised ANA, but they have not been diagnosed.
Just to be clear, that's anti-nuclear antibodies, is that right?
Yeah, that's right. And so they're not diagnosed with an autoimmune condition, but they are positive or out of range for the ANA. So there are a lot of markers, but we can't just look straight at one and then correlate a straight line. And you're probably aware also of the way I practice is I'm very step back and look at the whole person and try to so if someone says specifically they've been diagnosed with rheumatoid arthritis, of course I want to reduce the pain, but I'm not going to get myself too tied into the diagnosis.
Again, we can't just put these people into a box. We have to treat them as individuals, and then take that holistic approach, which you're spot on there. Going back to something like rheumatoid arthritis, you can treat the joints, and we do that, but it's often started in the gut. So the gut integrity is crucial to helping that patient move forward. Excellent. All right. Now, we'll talk about treatment approaches, not necessarily specific treatment. We've mentioned treating the gut as well, but perhaps you can just do a little coverage of what's the best way to go about treating these patients. Perhaps even maybe talk about what some of the symptoms might be that some patients should be looking out for as well.
Yeah, it's a definitely a tricky one because it's personalized and it's complex, but the symptoms, pain is usually there. Almost always they will complain of some gut IBS or gassiness or similar.
Yep.
And so then by helping the diet, modifying the diet, that will help the gut. And then maybe some specific herbs for the gut to get that calm down and less pain there. Physical joints and pain, anti-inflammatories, the classics like the turmerics and the fish oils, and we've got some really nice anti-inflammatories in our toolbox. And then multiple angles, because reducing inflammation in the gut will generally reduce inflammation in the joints or the tissue.
Yep.
Fatigue is a really common one. Now that could be a matter of, is the sleep not adequate? Are they not able to sleep because of the pain? So then you would reduce the pain, but maybe it's a lack of, maybe the nervous system is too stressed. So you can see me going down the path, and we're running into lots of choose your own adventures.
Yeah.
For patients. There's also, or underlying it all, is the minerals and the vitamins, because they're probably depleted most likely, and it's gone on for decades, and they're lacking a lot of the essential vitamins and minerals, which are cofactors. There's also a level of detoxification support needed, because probably because of the medications and just general lifestyle and environmental toxicity, there's been an added strain on those channels.
Can also be a trigger as well when you look at something like Hashimoto's or something like that.
Yeah, yes, definitely. Then I've mentioned about the stress. So even something like getting a sleep hygiene, looking at their sleep hygiene and getting a routine in there where they're not using electronics. And even if it's an hour or two more sleep, then they're going to get a benefit of that, more energy for the next day. Autoimmune diet wise, I do have a handout that I often use of the autoimmune protocol, which is very well known. I do that, but not always for everyone, because it's extremely challenging. I'll look at their diet and then I'll make because if they're a mother in a family of 5 and they're already struggling to cook, and I tell them, you've got to cut eggs and you've got to cut nuts and you've got to cut, and they freak out. They're already really tired and they just find that so overwhelming.
Yep.
But the dairy and the gluten are definitely my top starting points.
Yeah. Yep. And I think that usually applies for most people. In saying that, some people are very good with dairy and they may not need to under certain circumstances, or they just need to just cut out the milk, and then they can have a little bit of cheese here or there or something like that. So it is very individualized, and this is what is very important when it comes to diet, because some people just have too much of the one thing, of a good thing, and don't have variation in their diet, and that can just make making that change alone and being a bit more seasonal with their fruit and veg can really help a lot too. Okay, that's great, Shannon. Thanks for sharing all that with us here. And I guess it's a real rabbit hole we could go down with so many different aspects of autoimmunity and especially treatments. Also, do you do anything in regards the immune system, trying to regulate that specifically? I do find in practice I do use some herbs and even some nutrients that can do that quite well. We just bring more balance back to the immune system. Is that an approach that you do in addition to what you just mentioned as well?
Yeah, I do use some mushrooms, like the reishi mushroom.
Yep.
And I do use some immune suppressing herbs as well, as you
Yep.
probably use as well. If there is a really acute flare up and it's necessary. And then I am a big fan of probiotics as being a regulator of the T1, T2 helper cells.
Yeah.
An old-fashioned approach.
Excellent. No. And look, old-fashioned, but yet so modern and relevant in today's landscape, isn't it? The probiotics. So, but fermented foods, you know, for years have been good for balancing the immune system. And definitely plenty of traditional evidence behind that. Okay, that's great. Well, everybody, I hope you've got a good understanding of autoimmunity, or at least we've enlightened you to some degree. It is very complex and it's very individualized too. When we start treating patients, we have to really take an individual approach. And there's a lot more science and evidence day by day, it seems, to be coming in and backing up a lot of traditional practices, also course correcting us when needed. Yeah, I love working with autoimmune patients. I'm a sufferer of autoimmunity myself, only on a minor scale, and my father was also an autoimmune sufferer. It's very frustrating, especially if you've only really had experience dealing with conventional medicine, because it's they're very limited to what they can do. Of course, you know, very good if you need instant pain management or something like that. Conventional medicine is usually the best for that, but ongoing chronic disease, conventional medicine doesn't have the answers. So thanks, Shannon, for sharing what you've shared with us today. That was great. Looking forward to doing more of these videos throughout this year. Where can everyone find you?
Thanks, Brad. So Cura Medicine is where I live, in the West Coast, and that's curamedicine.com.au.
Excellent. And I'm your host, Brad Parkinson. You can find me on www.bradparkinson.com.au or Brad Parkinson Naturopath on Facebook. Hope to speak to you again very soon with another topic with my partner in wellness, my good friend, Shannon Brad. Bye for now.
See you later.